Swadika, and good afternoon. I'm Pensom Lersitichay, Director of the News Division from the Department of Information, Ministry of Foreign Affairs. Welcome back to the English language summary of the COVID-19 situation in Thailand, live from the Center for COVID-19 Situation Administration, or the CCSA. We have some very important updates to inform you today. So let's start with the summary report. Just now, Dr. Tui Sin has kindly briefed us for the statistics today, Friday, April the 2nd, 2021. We have reported a number of new confirmed COVID infections, which stand at 58 cases today. Of those 58 cases, 42 cases are from local transmissions, 3 cases are from active case findings, and 13 cases are from state quarantine. We have today a number of 1,247 cases of active cases that are being treated in hospitals. So that brings today's accumulated confirmed cases at 28,947. We have today a total of new recoveries at 58 persons. So number of new infections and number of new recoveries are the same today. That's a little bit remarkable. And so that brings total recoveries today at 27,606 persons. I'm also very happy to note again that today we have no new fatalities, so we have 0 extra fatalities. The accumulated number of deaths therefore stands at 94 cases. I'd also like to point out that as we have 1,247 active cases being treated in hospitals, it also bears reminding that our doctors won't be burdened because this number is still manageable. And we hope that as time passes by and everyone keeps vigilant, this number will keep on reducing. So moving along, I'd like to bring to your attention some observations from the new cases that Dr. Tui Sin just briefed us today. We found what could be called a possible new cluster of infections from Salaya district, which is in Nakhon Pathom province. This case happened, he was found infected, a Thai male, 19 years of age, a student from Mahidol University, and he was tested positive for COVID yesterday on the 1st of April. This particular individual traveled to several areas around the university and also went to Phuket during 25th to 29th of March. And of course, he went with a group of his friends. So that is also another possible problem there. Before that, he also visited an entertainment establishment, which was around Puttamonthon in Nakhon Pathom province with another group of friends. He also went back to stay at his dormitory in Salaya, that's at his university, and also met with his friends. And he also met with some other friends on the 31st of March and also attended class. So we are thinking that this particular case is a very important case in point and very important case study. The officials are now investigating this case very, very carefully. They are closely tracing his close contacts, and we will probably have more to report to you later on. We hope that this will be a very important lesson that while we have relaxed some COVID measures, it does not mean that we can be less vigilant or less cautious or practice less personal hygiene. So please be very, very careful and continue to practice DMHTT. Dr. Tuisin also mentioned that on the 31st of March, there are two particular important cases that worth mentioning about some personnel who were infected with COVID, found to be positive. On 31st of March, there were 5 chefs at one particular ASQ. These cases are also being investigated and traced back. So we will also have more information to report to you later on. And also on the 31st of March, there were also 10 Thai nationalities who arrived in Thailand and were found to have been infected with the SARS-CoV South African variant. And these particular individuals traveled in from the UAE and also from Mozambique. So these cases are also cases that the officials are closely following as well. So because of these new cases, Dr. Tuisin has reiterated how crucial it is for everyone to keep on wearing their masks and practice distancing, as I told you earlier. And he's also advised that we are approaching Songkran Festival or the Thai New Year. And it's possible that in our festive moods, we might forget to practice caution and put ourselves and others at risk. So please remind yourselves and your loved ones of this particular point, and please still practice caution. Now, moving along, I'd like to go into more details about some relaxation of quarantine measures that I mentioned on Wednesday. So since April the 1st, that's yesterday, we have, as of 1st of April, we have relaxed certain COVID measures, and they've become effective. And these are, what I'm referring to are the quarantine period for international arrivals into Thailand. They've been reduced. So they've been reduced based on whether they've come from high-risk areas and whether they've been inoculated by vaccines which have been recognized and approved by the World Health Organization or by the Thai Food and Drug Administration. So if you are a traveler from any non-high-risk country, meaning areas that do not have the COVID-19 variants or mutations, and you have been inoculated with the vaccines that have been approved by the World Health Organization or the Thai Food and Drug Administration or authorized by the Thai Public Health Ministry 14 days prior to your departure, meaning you must have been inoculated for both doses completed, then you will be eligible to undergo quarantine for a reduced period of at least 7 days in Thailand once you arrive here. And you'll see on the screen, this is the list of the approved vaccines for the 7-day quarantine period. And these are the CoronaVac by Sinovac, the AZD 1222 by AstraZeneca or Oxford, the AZD 1222 by Siam Bioscience, AstraZeneca, Oxford, the AD26 COVID-2S by Johnson & Johnson, the Tocilizumab by Pfizer-BioNTech, the Covishield by the Serum Institute of India, and the mRNA 1273 by Moderna. But let me also say that we must not mix this list with the vaccines that the Thai Food and Drug Administration has approved for inoculation in the country, because this other list is based on emergency use in Thailand, and these are 3 vaccines that are manufactured by Sinovac, AstraZeneca, and Johnson & Johnson. Vaccines by other manufacturers are in the process of applying for further approval by the Food and Drug Administration of Thailand, and if there are any developments on this particular issue, we will certainly update you. Meanwhile, those who are traveling from countries without COVID-19 mutations and with no vaccination certificate will still be subjected to a 10-day quarantine period. And finally, those arriving from countries which have evidence of COVID-19 variants or mutations are required to complete a 14-day quarantine period. And I mentioned this earlier on Wednesday already. So for the time being, these include the 11 countries, namely South Africa, Zimbabwe, Mozambique, Botswana, Zambia, Kenya, Rwanda, Cameroon, the Democratic Republic of Congo, Tanzania, and Ghana. And of course, this list will be updated every month to accommodate any changes, such as discoveries of new strains that may pose high risks. Now I'd like to mention a positive development, something that we've invented, because we have heard, for those of you who have found that entry into Thailand and the procedures we've set up are a little bit complicated or confusing, so we've heard those frustrations. And therefore, the government has now created a new comprehensive website called Entry Thailand. So you can see on the screen here, this new website will provide you with a step-by-step guide of what you need to do in order to get your documentations ready to enter Thailand. Just follow the simple steps there, and you can complete all the requirements just on this particular website. Also, all the necessary links, such as COVID insurance policies, options for flight bookings, available hotels for quarantine, and also a link to process your certificate of entry, all these are conveniently provided at each step to get you through this process. So let me take this opportunity as well to urge everyone to refrain from seeking out information from unofficial sources, as these could be outdated or incomplete, or worse, they could even be a scam. You can always check out the updated information right here at the CCSA's briefings, as well as our social media accounts. So let's help each other fight the pandemic by also fighting against the infodemic that's happening all over the world at such trying times like this. And you can see, I think maybe on the screen, we'll be seeing right now, there is a short list of all the documents that you will need. This is just to recap. When entering Thailand, you will need a hard copy of all these documents, which is a passport, a valid passport, or a certificate of identification, your flight details, your ASQ hotel booking voucher, your certificate of travel or your certificate of entry, your COVID-19 test results, and again, good news that you don't have to have a fit to fly certificate anymore. And of course, when you arrive in Thailand, you will need additional documents, which you need to apply or download the Thailand Plus application and the T8 form, which will help declare your medical or your health status. So, before ending the briefing today, I'd like to inform you that the Thai government welcomes the efforts by the private sector to import COVID-19 vaccines into the country. And although only vaccines that are approved by the Thai Food and Drug Administration can be imported, private companies or hospitals will have to inform the Thai Food and Drug Administration about which vaccine they plan to import. And companies can also negotiate with those vaccine producers about their import plans. And so having the private sector negotiate with them and initiate importations of vaccines would mean that Thailand will have more options for everyone, more vaccines. And this means everyone living in Thailand, including you, our expats, our foreigners, our English-speaking audience here as well. And as an FYI, we have the number that you see on the screen right now is the total number of doses of COVID-19 vaccines that have already been administered in Thailand as of yesterday. But as of today, Dr. Tuisin just mentioned, we have a total number of 203,650 doses of COVID-19 vaccines administered. So that's 203,650 doses already administered, and the number is going up. So with that, I'd like to end my briefing today. Thank you for your kind attention, and please remember to stay safe, stay healthy, have a great weekend, and we'll see everyone again on Monday. สวัสดีค่ะ
ขอบพระคุณค่ะคุณเพ็ญโสมเลิศสิทธิชัยผู้อำนวยการกองประมวลและวิเคราะห์ข่าวกรมสารนิเทศกระทรวงการต่างประเทศนะคะแล้วก็นี่คือทั้งหมดของการแถลงข่าวจากศูนย์บริหารสถานการณ์โควิด -19 ส่วนช่วงบ่ายวันนี้ตอน 14 นาฬิกานะคะคุณผู้ชมสามารถติดตามความคืบหน้าเรื่องของการเปิดพื้นที่เพื่อรองรับการท่องเที่ยวโดยเฉพาะนักท่องเที่ยวจากต่างชาตินำร่องเริ่มไปตั้งแต่เมื่อวานนี้วันที่ 1 เมษายนรายละเอียดเรื่องของการเปิดรับนักท่องเที่ยวในแต่ละพื้นที่เป็นอย่างไรสามารถติดตามได้นะคะจากทางรัฐมนตรีว่าการกระทรวงการท่องเที่ยวและกีฬาและท่านผู้ว่าการการท่องเที่ยวแห่งประเทศไทยค่ะหมดเวลาของการแถลงข่าววันนี้แล้วนะคะดิฉันปวีณาฟักทองพร้อมทีมงานลาไปก่อนสวัสดีค่ะ